Hi friends, today I'm really excited and very pleased to have Dr. Ayan Kar with us. He is the consultant in Kolkata, Ayan Kar Hospital, highly skilled person, very knowledgeable, thorough gentleman, and he is leading the service of heart failure in Ayan Kar Hospital. Welcome, Ayan. Please tell me about yourself a little bit to the audience. And this is the CSI West Bengal podcast series. And how did you start your career and what is your aims and objectives in heart failure field?
Thank you, sir. The pleasure is all mine. I am Dr. Ayan Kar. I work as a consultant interventional cardiologist as well as a lead in heart failure services at Narayana Health, Rabindranath Tagore International Institute of Cardiac Sciences. I have started my career predominantly, of course, training as medicine and then, of course, became a cardiologist, as you know. And right now I dwell in the subspecialty of heart failure services primarily, and I happen to lead the heart failure services in my hospital. As you correctly said, heart failure is a very evolving field, and I think that is a much less addressed, specialty, if you call, in our part of the country, because we do not have any protocolized management for heart failure in a lot of places. And if you currently look at all of the data that comes on heart failure, it tells us that there's a lot of there's a lot of need to do more in heart failure as far as we are concerned.
So what is heart failure? Is it like a heart attack and heart failure, or you can have heart failure without heart attack?
So as you correctly said, so heart failure is predominantly a clinical, it's a symptom complex. It's more about symptoms of a patient. It's how the patient presents clinically to you. Yes, you are right. It can present even in the absence of a heart failure, which is commonly a very common notion amongst the normal people, that how can you have heart failure without a heart attack? And it is easily diagnosed, but then of course it is not aggressively treated.
So how a common person will get to know that if he visits you, you are going to utter a word like heart failure, you are suffering from heart failure, unfortunately. So what are the common symptoms a man suffers before they ask for your advice? What are the commonest symptoms?
So commonest symptoms, I think, is shortness of breath, the effort intolerance, unable to do regular day-to-day activities. You would sometimes be also associated with swelling of the feet, unable to lie down in the night, having a lot of persistent cough. That is something which results in heart failure. I often find it very difficult. So this ominous term of heart failure, as I call it, it's very difficult to put that as a label on your patient, because patients are generally very scared. I think even they would have been happier with the diagnosis of heart attack probably than having heart failure. For them, that means that the heart is probably lost
End.
and there is no further treatment for this.
Okay. So if you really want to comfort them with good words, counseling, advice, therapy, what are the best way to counsel the family and the patient that it is no more like a cancer what used to be during our student days, your father's student days. Nowadays the longevity has increased. So how do you convince them that it is no more a cancer, it is treatable, it is a doable thing, it is achievable? So how do you convince the people that it is not a end of life?
So I forgive me for saying this, but sometimes I feel even physicians are alarmed at the diagnosis of heart failure. So the very looks of a physician when they pronounce a patient with a diagnosis of heart failure, kind of, it pronounces ominous outcomes for the patient. So I think first thing is that you need to tell your patient that heart failure is also just another clinical symptom. And today, with the current therapy that we have for heart failure, I think it is fairly well treated, provided it is aggressively picked up early on and it is treated aggressively by a multidisciplinary team. So important is that you need to assure your patient that it has been picked up at the right stage, and you are able to say that there are drugs for this. Of course, the drugs don't work immediately always. You need to give them for quite a significant amount of time to reap the benefits of these kind of drugs.
Yeah, so that means it's not an end of life and it's not a cancer. You can live a normal life, longer life, 10, 15, 20 years with simple multiple medications. But before advocating or advising multiple drugs or pills, you need to diagnose them that what type of heart failure you are suffering from, what is the prognosis, and what are the the therapy is available, like the valve, or it is a muscle, or valve plus muscle. So how do you diagnose heart failure, or what are the tests you prescribe to come to a conclusive diagnosis of heart failure? You're not missing anything like amyloid or any other undiagnosed disease, aortic stenosis. So how do you evaluate these patients for heart failure?
So thankfully, the diagnosis of heart failure today is quite easy. As I told you, it is predominantly a clinical diagnosis. It has to be confirmed with some biochemical tests also. Predominantly, that would be biomarkers. We're looking at NT-proBNP. Thanks to, evolution of lab services in our part of the country, today it is a very cheap test. It is not as costly as it used to be maybe 5 years back. And of course, a standard ECG and echo is also additional test which will almost make an 80 to 90% diagnosis of heart failure. Beyond that, depending on the phenotype and depending on other clinical risk factors, you could ask for additional imaging tests or other kind of tests to further qualify your diagnosis and understand what is the etiology of heart failure.
Right. So once you diagnose them having ischemic heart failure, that means you have blocked coronary arteries, post-angioplasty, post-heart attack, post-bypass. So one variety of heart failure. And there are other varieties that is non-ischemic heart failure, like you don't have any stents, you don't have any blocked coronary arteries, and there are two different categories, but ultimately the treatment is also same. There are also newer therapies like iron, like pro-BNP you have mentioned, their iron level, their hemoglobin level, their pro-BNP level, echo, MRI, ECG, chest X-ray, clinical examination, all these are important. Now, we have pills. Now, what are the newer therapies like injectable therapies, anti-diabetic drug therapies, has kind of a paradigm shifter or a game changer in the field of heart failure? Like what are the newer things, newer drugs before going into device or transplant or organ donation?
So I think, you have always taught this to us that we have these 4 pillars of heart failure therapy. So when we talk about heart failure therapy, I think we'd rather restrict ourselves to the heart failure with reduced ejection fraction because that generally has a...
So the pumping number is very
less,
important. That
yes.
categorized one is reduced.
So we have a fairly protocolized therapy as far as heart failure with reduced ejection fraction. So we have 4 standard drugs which we give, which generally would be, one would be the ACE, ARB or ARNI group. You have the MRAs, you have the SGLT2s, and of course, beyond that, you have beta blockers. So these 4 drugs generally form the hallmark of treatment as far as heart failure with reduced ejection fraction is concerned. Heart failure with preserved ejection fraction, on the other hand, I keep telling it is not probably all about the heart. It's all about the outside of the heart. So it's all about comorbid control, about hypertension control, obesity management. It's about weight reduction. It's about iron deficiency anemia being reduced. And also, it's very important.
Thyroid. Creatinine.
So correct. So you said, so there are sometimes reversible causes of heart failure, which needs to be aggressively evaluated. Like you said, thyrotoxicosis or high output cardiac failure, which can be because of severe anemia for that matter, is something that is absolutely treatable. It's 100% treatable cause of heart failure.
Right. So, once these drugs fails and your blood pressure become very tender, like you have a very low blood pressure, you cannot tolerate the good dose of drugs. You have patients complain that they get postural syncope, feel giddy, and your physician tells you that, look, his blood pressure is having very low number, and they're really concerned, very worried about such a low blood pressure. Not always true that the 90 millimeter blood pressure is going to kill you. And many heart failure patients, they can tolerate a good dose of drugs in spite of having low blood pressure number. So for physicians who are watching this program and you are a heart failure specialist, how important is that blood pressure in prescribing these modern drugs and adopt these 4 pillars of heart failure therapy in your practice?
So as I continuously tend to say this, so in heart failure, blood pressure is purely a number. It should not preclude treatment. What is important, as you said, sir, is the symptomatology, whether it's a symptomatic hypertension or an asymptomatic hypertension. If it's a symptomatic hypertension, we definitely need to relook, have your drugs sorted, maybe come down on certain medicines, reduce, titrate doses, add other medicines. But if you have asymptomatic hypertension, so a lot of my patients, they'll be on drugs, they'll have blood pressure of 80/50, and they'll be happily walking into my room and going back without any problem. So in those cases, there is no reason for you to down titrate your drugs, or for that matter, stop medicines. So I often see a lot of people stopping medicines because they are scared about the number of blood pressure. But asymptomatic hypertension does not need to be treated, specifically in this subset of cardiology.
Right. So when we are facing end-stage heart failure, like your drug therapy has failed, your bypass has failed, your device like CRT, CRTD, special pacemaker has failed, and these people need transplant. So organ donation is a real problem in our country, especially in West Bengal. We are doing better than what we used to do, used to have, used to avail in the past, but things are getting better. Now, what is the most important inertia or difficulty or the hurdle for organ donations and heart transplant program in your institute?
So this is a very critical part of the advanced heart failure therapy. Like you said, so at some point drugs work very well. Beyond a certain point, drugs fail, and that is when advanced heart failure comes in. So advanced heart failure, we're basically looking at low cardiac output symptoms. We're looking at end-stage heart failure.
Right.
Now, unfortunately, in end-stage heart failure, we have the biggest problem here is you are basically looking at replacing the heart. Now, the heart can either be replaced or you can have an artificial heart put to pump and do. Now, artificial heart is terribly costly and is generally not easily is the primary option in most of our patients. But I think heart transplantation, on the other hand, is fairly less complicated. And the only rate limiting step there is probably the organ donation. So the awareness part of organ donation is something that I think really would want to emphasize on. It is very important that we as physicians and we as, citizens of our country, we should participate in organ donation, sign up for organ donation drives, because remember, it's a gift of life. Remember, one body does not save just one life, but multiple lives. So you can give one lung, you can give kidneys, you can give liver, you can give your pancreas, you can give skin and cornea. So multiple lives can be saved by just one organ donation. I mean, so when we started out on this program way back in 2018, the chances of organ donation was very slim. But thanks to a lot of government initiatives. So if you look at the level 1 trauma center at SSKM hospital, it is all about organ donation and donation of life. So they have these grief counselors, and they are the largest donors of organs as far as the city of Kolkata is concerned. So over these last few years, we've actually managed to do about 15 cardiac transplants, including 2 units, that is NSH Howrah as well as us. And so this didn't happen at one go. So we've had a lot of we've engaged a lot of NGOs, we've engaged grief counselors. We are still passing on this message to a lot of patients. Sometimes our heart transplant patients actually act as our emissaries. They act as our advertisements that, life after cardiac transplant is something that can be cherished for. So remember, the first transplant we did, she was a young housewife. She still has 2 children. She was suffering from postpartum cardiomyopathy, and she's doing extremely well still today. I mean, she's still able to take care of her children. The only trade-off probably here is, your cost of immunosuppression. Here, there is something more we can do. I think we would ask our government to help come up with certain ways or schemes in which they can subsidize this a little further. And having core labs for transplant immunopathology is something that we would really ask for in this part of the country, because we still have to outsource a lot of our investigations elsewhere, which becomes very costly. So these are things we really would want to engage people for.
So that means there is a lot of hopes in organ donations for heart failure, for liver failure. And not only human being, the animal has also come into help of helping donating their organs by changing their gene, like xenotransplant, like pig kidney. A patient has gone back home. So friends, I think today we have learned a lot from Dr. Ayan Kar. And heart failure is not anymore a killing disease. It is treatable by multiple drugs, polypharmacy. All these are available in Calcutta, in Eastern Jode. And we have access to all the devices, MitraClip, pacemaker, CRTP, CRTD in his good hands. And he has helped thousands of people. His institute has helped thousands of people recovering from devastating heart failure. and he keeps on doing or gives his best blessings to the humanity. I hope it will continue. He will serve the humanity with much larger hand, larger heart, bigger hand. All my blessings, all my good wishes with Dr. Ayan Kar. Out here, I'd like to thank for being here with me. This is podcast CSI West Bengal branch. Please subscribe to our channel. Thank you very much.